Over to you.
Well, Faith, thank you very much. I want to first thank you, Faith, and all the wonderful people at Grantmakers in Health for bringing us all together today. It's a privilege to serve as the venue and particularly to have the opportunity to share the idea of a healthy America with everyone here and with all those who are listening in on our telecast and our internet connection. It is really a moment when each of us, in our own perspectives and from our own vantage point, must be reflecting on the key point, Faith, that you raised, that the pace of progress in health in America has fallen behind where we should be and also fallen behind the rate of progress in many other developed countries of the world. The relative standing of the United States overall has declined. Disparities within the United States have sustained or increased. And the rate at which we are improving to date is not such that we're on a trajectory to catch up. This is not an acceptable situation. It's not acceptable in health terms. It's not acceptable in our sense of a people. It's not acceptable for us as professionals and concerned citizens about the future of our country. We know from our own experience that we're not going to spend our way to success simply by pouring more money into our existing medical care system. We've already tried that experiment. It doesn't work. In fact, we're very unlikely to be able to cure our way to success, as desirable as that is, once disease strikes. Our only real prospect for attaining the levels of health that we as a people deserve and that we as a nation aspire to attain is by preventing disease before it starts. And we have a great deal of knowledge about ways that we could improve prevention of disease, ways that we can act on individually, ways that we can reinforce and make possible as a community, ways that policymakers in our nation can make more practical and affordable. At the Institute of Medicine, from the very beginning of our founding, we've been involved not merely in trying to identify what should be done, but also to see what can we do to help make that the reality. How can we discern not just what are the important ideas, but what do we do to translate those ideas into policy, practice, and experience for people? One of the most exciting initiatives that we had the opportunity to engage in was a collaboration with the team who are represented here today as the Public Good Projects, and prior to that and currently with HBO documentaries, to do a series on the weight of the nation, a series which garnered a total of 3 Emmy nominations in its original form and its later programming specifically aimed at younger people, a series that laid out in graphic and really compelling form the nature of the problem and what needed to be done, and a series which set, I think, an important standard for being scientifically accurate while telling the story in a compelling way. And out of this experience for us, we came to the conviction that we could do more, we could aim higher, we could be more inclusive, we could try to take advantage not simply of one documentary series or one producer, but all of media on television, in entertainment, in social media, and in other forms to reach people on the things that they can do to give them a better chance at a healthy life and avoidance of disease. And it's not a long list of critical things. It's a relatively short list of key prevention maneuvers that every one of us is capable of adopting and incorporating into our daily lives, that all of us as community leaders can help reinforce, and as a nation can make more realistic. It's about tobacco use. It's about the excessive use of alcohol. It's about our diet. It's about our activity levels. It's about our abilities to connect socially one with another. These are easy to say, and they're very hard to introduce and to sustain. But the idea behind A Healthy America is that we can take fuller advantage of the power of the media to reach people, to touch people, not simply to educate, but to change the way we think about our own lives and the lives of our families and our communities. Over time, our aim is nothing less than to create a culture of health in America. And by a culture of health, I mean a daily life where you choose the healthy choice without having to make a decision about it. It's just the easy, the natural, the right thing for you to feel good about doing every day. It's the cool thing. It's the thing that makes you feel good, and even most of the time, you don't even have to think about it. Is it possible to do that? We believe it is. I can tell you, I'm sure it's impossible if we don't try. Many activities in our nation already are dedicated to parts of this problem and working on it in different ways, locally, in states, even nationally. We hope to add force, direction, and success to the equation already in place. We're here to talk with you today because we want to enlist your help. We want your ideas. We want your thinking about ways that what you're doing and what you care about in the several foundations, programs, and activities represented aims toward the same or parallel goals. We want to gain partners and contributors to this endeavor. And we really look forward to the time together as a way of gaining your feedback and your take on what we need collectively to accomplish and how we can best do that. None of this, in my mind, from the IOM expert panels alone, would be even imaginable if we didn't have already in place a building base of the expertise and experience in the media that is represented by public good projects. And we're really proud to be able, under the aegis of Grantmakers in Health, to come together with you, with our colleagues at the public good projects, so that you can hear from and take away and contribute to our thinking across the role of all of us, and particularly through the media, to promote a healthy America. And so, if I may, I'd like to turn to my colleague, John Hoffman, the President and CEO of the Public Good Projects, for his comments as well.